morning, good morning. Welcome, guys. This is not a bad way to spend a Sunday morning, right? First and foremost, I want to thank the Bucks for this huge letting us into their practice facility. How awesome is this? So my name is Shane Simic. I am with the marketing team at Florida Hospital Carewood. I have the pleasure of welcoming you guys to our Men's Health Symposium here at the Advent Health Training Center. Before we get started with our doctors, we'll quickly draw your attention to your programs if you didn't pull one up, just to kind of talk through the run of show this morning, what we're going to get doing. So we're going to start with our educational sessions. That'll go from 9:15 to 11:45. In between each of the doctors talking, we are going to take a 10-minute break. And then at the end of every physician, if we don't have time for taking questions in the stands right now, before we get to the next speaker, after each doctor speaks, we are going to have them go right over there. You can see a sign that says Ask a Doc. We're going to have them go over to that area. So if you have questions after a presentation, and whether you weren't able to ask them here, or you potentially just want to ask it in private, you can go ask them over there as well. So we're going to take those 10-minute breaks. When we get done with our physician education around 11:45, we're going to take our final break, and then we will be moving over to our end zone bleachers for our keynote address from Buccaneer great and NFL legend Derek Brooks. And then directly after that, we're going to kick off our lunch out on the patio where you already had your breakfast, and then we're going to have field games and enjoy the Bucks game at 1 o'clock and hopefully watch them destroy the Giants. That'll work. All right, so we'll go right into it now. So our first doctor, I'm going to give you a quick intro, Doc, is Dr. John Schmittner. I got the whole rundown. Dr. John Schmittner is a board-certified cardiologist who specializes in advanced heart failure and cardiac transplantation with over 20 years of clinical experience. He is the medical director of Florida Hospital Pep & Heart Institute's Advanced Heart Failure and Mechanical Circulatory Support Program. He received his medical degree at Temple University School of Medicine in Philadelphia and is a dual fellowship trained in cardiovascular disease and advanced heart failure and cardiac transplantation. We got some experts here today, so he's our very first one. All right, Dr. Schmittner, here you go.
Thanks. Can everyone hear me like this, or you need a microphone? Okay. So I'm sorry to start off with like kind of a downer, heart failure, but it really is important. So we'll kind of talk about like men's health and stuff like that. And we're all about the same age, so it's actually a good audience. So I have no financial disclosures besides working for Advent. And one, I am, real quick, I'm from Philadelphia. I love living in Tampa, and I also love working for Advent because it really is a wonderful organization, they're great physicians, and this is the first time in my life where I've worked in an organization that kind of shares my beliefs about how to treat people and how to look out for the other person. And I'm glad this is just guys because I think as men, there's always big emphasis on women's health, as there should be, but men's health is a little bit different. So the heart is just a pump, and it runs on electricity. So blue blood comes in from the lungs, goes out the pulmonary artery, and comes back to the left ventricle and gets pumped out to the aorta, the rest of the body. Now, it's a pump that runs on electricity. It's really all not that complex. Heart failure is actually really bad. It's something that, if you, like when I go home to Philadelphia and one of my friends says, oh, my dad's got, lung cancer, you're like, oh man. If someone says they have heart failure, almost no one really says it. About 1 million people get diagnosed new every year, and which means that every year there's another million. And it really is what people come to the hospital for, and really for men and women, it's actually what people die of. This is a really bad slide. Lung cancer, pancreatic cancer, and end-stage heart failure. On the left is 1 year mortality, means who's alive at the end of the year. The only thing a little bit more is pancreatic cancer. So if you see me as an advanced heart failure transplant person, if I can't transplant you or get you better on meds, you're dead in a year, 80%. And that's very sobering because when you hear pancreatic cancer, you're like, oh my God, I get to the doctor right away. One, you can't smoke. You just can't. I mean, it's just, that's the one thing, if you smoke, you just gotta stop, and there's other ways to smoke, other ways to stop smoking too. This is really bad. Now, we used to think that people had heart attacks because they get narrowings in their body. It's really more about inflammation. If you have a pipe with crud in it, when you heat the pipe, what happens to the crud? It flicks off. It goes down to a smaller pipe, and actually what that happens. Now, inflammatory food is anything with corn syrup. I'm 50. In the 70s, you get a burger at McDonald's, it wasn't that bad for you. And it wasn't that cheap. Everything today, you can't make a burger for $1 and have it be good for you. It's all for corn syrup. Corn syrup affects a molecule called lectin in the body. And you need lectin to tell your brain that you're not hungry anymore. if that is interfered with, you eat meat till your stomach distends. It actually is kind of addictive, and also corn syrup makes you have more central adiposity, more fat here. It is just really, really bad for you. I weigh myself every Friday, and that sets my tone for the weekend, you know what I mean? So if I'm down a little bit, I got some pounds to play with, but if I'm over what my weight is, I can say, you know, I gotta stop a little bit, right? Like, you know, that's what, you know, you're doing. I think you should have a cheat day.
Yes.
Every week. One, I don't like the word diet. I like the word healthy choices. You have your cheat day, you look forward to it all week, just eat what you want. The next day, you may pay for it because as you eat better, your immunity against bad food goes down. So someone who never drinks and they have a couple martinis, the next day they feel like death. But someone who drinks every day, they really don't see the difference. So it's a light beer, 90 calories, and it's a flat margarita pizza, not big much. Now, being from Philadelphia, this is my cheat day. I got a big old pizza, I'll eat the whole thing, and when I was home for the Panthers game, it's about how many beers I drank. Because I just could not believe what was unfolding in front of me. It's blowing a 17-point loss. But I do the cheat day. Like, I look forward to it every single week. Today it's football. We're going to be playing. We're going to get annihilated by Breeze in New Orleans today, the Eagles. And, you know, tomorrow I'll pay for it. But, you know, I look forward to it all week. And it makes me stay on my healthy choices. I do a Paleolithic diet. That means you eat what basically you can pick up from the ground if you were a caveman. So it's basically anything hunting, gathering. I don't eat anything that will stay, that you can eat after we're all dead. Nothing that comes out of the bag at all. I eat lean meats. Last night I had great steak, I had asparagus, I had mushrooms. Nothing, no bad carbs. Salads, vegetables, nuts. I don't eat any of this stuff. It's all processed. It's all really bad for you. It takes about 4 or 5 weeks to get it all out of your system. But man, once you lose this and you feel better as a man, you feel so great. You know, again, no one drinks a martini for an NFL game. I don't know, I wouldn't. So I'll have beers and stuff like that, but I just don't drink heavy microbreweries and things like that. Because you want to decrease inflammation again. Inflammation is very, very bad for heart health. And no one's proven this is better for you. I know that I dropped a lot of weight on it. That's me. And that's me a year later. 70 pounds. I was 270 during my fellowship for cardiac transplant, and I was eating like 2,000 calories because I ate emotionally. After being on call, I eat Chinese food, be like 2,000 calories. I was just eating crap. And I mean, I look like a criminal or a child molester there, like with the little beady Irish eyes. And then once I got on a better diet, I lost 70 pounds. I also found out I was insulin resistant. So I took a little drug called metformin. It's pre-diabetes. My metabolism got better. So eating is not just what you eat, it's when you eat and how you eat it. So don't eat late and things like that. So this guy, and this is a scary joke. Bruce, this is a real patient. Bruce, a great guy. He was a lawyer from New York. And he's that kind of guy. He's like 5'6", weighs $135. He can play 10 rounds of tennis. He can run. He had a low cholesterol. And he's the kind of guy at 50 you would think never anything happened to him. He had a little bit of acid reflux after meals on a road trip. He literally was out on a case in just, I don't know where in Texas. He got airlifted to Houston, and he was in cardiogenic shock. He got 2 stents in, really bad heart failure. And this is a guy you would never think anything would go wrong with him. But he had a little bit of inflammatory diet, but with meds, within 6 months, he got to get better. But he had total PTSD, and he used to just call me almost every other day, like because he's worried about everything like that. I lost my best friend at 51, massive heart attack. He was a physician like me. 2 weeks after a stress test that was called normal. He was on that metabolic McDonald's diet, and you know, I just stand every day. It's like my older brother. So it is like diet with cardiovascular health really hurts. So what is heart failure? Basically, we used to call congestive heart failure before. So basically the heart can no longer give all the blood to the body that the body needs. And it really just cardiac output, how much blood is squeezed every single beat times number of beats per minute. So if you're really good health, your heart rate's probably in the 50s because you can push a lot of blood out. It is a cancer of cardiology. It's not like a stent or things like that where we fix you immediately right away. It's very insidious, And it really does take away from everything that makes us feel like men. You just, when you get it, you just can't, you aren't who you are. And it could be really at any age. So why do people get heart failure? One's bad genes. Dad, grandfather, and your son have the same genetic problem. The other is bad luck. You get a virus. You can get a common cold and it can cook your heart and you need a transplant. The other is, most times, is bad habits. Heart attacks, heart problems, diabetes, strokes, they all kind of lead into that. Ischemic heart disease is basically you have a heart attack, no blood goes to the pump, and the pump dies. It won't pump, it dilates, it thins out, and you need lots of meds and cardiac rehab and lifestyle changes. Hypertensive heart disease is very insidious because most of us high blood pressure before you don't know. As a cardiologist, I couldn't feel my feet. And I was blaming my girlfriend at the time. She lived in Lauderdale. I'm like, your floors are too hard. And she's looking at me. What does that even mean? Do you think maybe you have something wrong with you? So I went to like a physician, and they're like, dude, you have a diabetic neuropathy. I go, can't. I'm 40 years old. But you do. And I found out that I was really, really in bad shape. I had high blood pressure. So why is blood pressure? People go, well, why is it so wrong to have high blood pressure? Basically, if you're pushing against a wall that won't move, and that's blood pressure, heart's pushing against it because the wall's too high, you'll get stronger at first, and your muscles will go like that, but eventually they will thin out, and eventually it will fail. Your heart gets very stiff, so you need to control blood pressure really too late, and if it is too late, then you need to see someone like me or Dr. Cotto to get heart failure medications, cardiac rehab, all that kind of stuff like changes. A lot of times you have stiff valves, leaky valves, and that causes, again, just a pump that runs on electricity, and if your valves are leaky, the pump doesn't work so good. Valve replacements, there's a lot of stuff that we can do today. Idiopathic means we have no obvious cause. Sometimes it's genetic. It feels very unfair that just something happened to you and we treat it with medicine and so on and so on. So, if anyone goes to a cardiologist, they always ask you what your ejection fraction is. It's something you can tell the patients. Basically, your EF or ejection fraction is how much blood is pumped from the heart into the aorta after every beat. And normal 60%, meaning that 60% of the blood gets pumped out with each beat. And less than 40% would be considered heart failure. So if you had a glass of milk and you only poured out 40% and 60% is left, it's heart failure. This is an echocardiogram, and this would be your ejection fraction. Sorry, go back. And basically, this is like if you cut the heart down sideways like an orange. This right here is your left ventricle. Blood comes in here through the left atrium, and you can see it's a nice muscle, nice bumps out, and then goes out the aorta. This next one is actually one of my patients, and this heart barely moves. This kid was 19 years old. This is a normal heart, and this is a heart from high blood pressure. It's real, real thick, and then eventually it dilates out and fails. X-ray on the left is a normal heart, and look at that big, big fat heart that's all dilated out, and that won't work. And that's what you would see in your X-ray. Signs and symptoms, shortness of breath on exertion. That's obvious. Red flag is, I can't do what I used to do, doc. And often, like, your wife will pick that up, or your kids. Orthopnea basically means that you're short of breath when you're laying back. So if you're sleeping and you gotta sleep with more pillows, or if you're in an armchair sleeping, most likely you have pretty bad heart failure by that time. And then what happens is that you get swollen legs, it goes up into your lungs, and you feel better when you're sitting upright. So if you need lots of pillows to sleep to avoid shortness of breath, then most likely you do have heart failure. These are like the little things that you can kind of figure out. This just means that at night you wake up and you're anxious and you can't breathe. Yeah, it's almost like you had a nightmare. You're like that. It's actually probably because fluid is accumulating in your lungs, and as soon as you sit up and put your head out a window, you're actually not so short of breath again. More signs: coughing and wheezing. A lot of times someone who's 60 will go into an urgent care center short of breath and they'll diagnose them with asthma. Who gets asthma when they're 60? Never happens. Or it's pneumonia, but they don't have the fever. It is heart failure, and usually wrong diagnosis is unfortunately the Achilles heel of cardiology. It also could be from the medications you're on. It could give you some like other medications for other diseases. Gastric, you have reflux, and that could make you feel like you have heart failure. But if you have decreased exercise tolerance, if you have decreased cardiac output, decreased libido or ED, they are often a sign that you might have something wrong with your heart. Swelling, palpitations, all this kind of stuff. You could have changes in your urine output. It could be your prostate. You know, I'm 50. It takes me forever to urinate. But maybe it's my prostate, but maybe just that my kidneys are going because I'm starting to have heart failure. Fatigue is a big one. GI symptoms. If you just have a big appetite and you don't eat as much as you used to, or like I eat a sandwich but I'm only eating a third of it now and I'm full, that is a very bad sign that your right heart doesn't work anymore because you're getting backflow. And again, ask your wife. If your wife says you are not what you used to be, then it's a pretty good sign there might be something wrong with you. So we classify heart failure into Class A. You have risk factors, like I did, but you don't have a heart disease. Class B, you have heart disease, no symptoms, and then you start sliding into symptoms, and by the time you get to where it's refractory, you see someone like Dr. Kodo or me. Pharmacology, these are the good drugs. If anyone is on these drugs, you would know what these are. Water pills, beta blockers, and these are all known from evidence-based guidelines that they work. But this is one thing, and again, for anyone who's African American, these last two drugs they have to be on, because in studies, African Americans do much better on these two drugs. We've learned that almost everything today is probably genetic. So, people from Southeast Asia, especially Laotians or Vietnamese or Hmong people, have a thing called pulmonary hypertension. That if you're not looking for it, because you don't understand different races and different genders have different problems, you'll miss it. Now, this is the big drug these people get. They're called ACE inhibitors. It causes low blood pressure that you feel, but that means you're actually getting better because we push you to a wall, and once you get dizzy, you come back a little bit, and then because the drugs work on a hormonal level. It can hurt your kidneys a little bit. In potassium can give you a cough, give you some swelling. Beta blocker side effects. I can't tell you how many people will pick up on a beta blocker. It slows your heart rate. It's great for your heart when you have high blood pressure or heart failure. Causes fatigue, you get tired. Also kills your libido, which ain't so good when you're 40. And it causes ED. Now, what happens is you're on these drugs, and like your doctor never discusses the risk factors. You know, everything in life is a choice, right? There's no free lunch. So when you're on stuff, you always ask, like, what are going to be the risk factors? And you might say, you know what, I don't want to be on that drug because I don't want to lose this. And again, it's your balance. Unfortunately, in my field, a lot of my patients are old and dying. I don't go to funerals, but I go to a lot of wakes, or whatever you call it. And the spouses or the parents, they never say, I wish we did more. They say, I wish we did less. Most people today are okay with having a little bit of risk of death at the end of their life if they can live better in that time. I know me, I don't want to live to 95 and have the last 15 years be horrible. So you just ask your cardiologist to switch to something that maybe has a better side effect profile. Aldactone and Pleuronate, great drugs for heart failure, great drugs. They give you breast swelling, and a lot of breast swelling. They actually give you breast tissue, and it gives you ED. And if you don't tell your patient before that, they come back in 6 months. Not only are they not happy, you have broken their trust with them, and they will never trust you again. So these are very important things for you to kind of like talk over your doctor. Because let's face it, you go to a doctor's office, like last time I went to the doctor, I was sitting there, taking the day off from work. Finally I said, who has a 2 o'clock appointment? 5 people raise their hands, right? I'm like, so physicians don't have enough time anymore to go over all these things. Sometimes there are other things, you get shock boxes and all this kind of stuff. We actually do something called a heart pump, but I would love to get into it, but for time I can. It's a great thing we put in the body, blah, blah, blah. So I believe very much take steps against bad habits. Don't diet, just do a healthy life choice. What I do usually is I might tape a game, turn off my phone so my buddies from Philly don't text me from my kindergarten, and I'll get on my treadmill and I'll run during the game. You know what I mean? I'll watch the whole game, but I will just run, or I have like a recumbent bike at home, which is Sears because it's going out of business and that much money. Even if I'm going kind of slow, I'm still doing something. 5 days a week, you got to do weights. Don't just do cardio. As men, as we lose our muscle because our testosterone goes down, the muscle, the glutes and the hamstrings and quads, they make insulin that the pancreas takes out to be effective. So if it's not effective anymore, you need more and more insulin, and eventually you become diabetic. So I still do squats and all that kind of stuff. Recovery time as we age. 2 weekends ago, I biked 80 miles. I had this idea that I was young. And you never have that spurt, like, I feel great. I crawled upstairs at Crag, my house, and I crawled into my bathtub, and I took a lot of Motrin, and I really couldn't do anything for a couple of days. We need recovery time. Always, if you have a good workout, take 2 days off, and you have to heal. I mean, this is why people do steroids, right? What's that?
Weights.
Weights are very important. Bench press? Well, I think machines are better because they take a lot of like the awkwardness out of it. Definitely do the circuits, bench press. Every single muscle you can work, but especially these big ones. You got to get rid of processed foods. I mean, sometimes I'll eat them, I feel like crap. They are really, really bad for you. Don't eat at night. You don't need to. Okay, 2 minutes. No one goes out to fill up their car 9 o'clock at night in the rain when they have half a tank, right? Guess. Most of us have eaten pizza at night. You're not going to starve. It's really just emotional eating. Now, when you have kids and carbs at home, I know it's hard. Medical compliance, always be compliant with all the problems. I'll talk about testosterone replacement. I think this is really important. A lot of docs don't talk about this. We used to think it was really bad for you. The data is unclear. You know why? No one grabs 20-year-olds and checks your testosterone, right? Don't do that. So we really don't know what's normal for most guys. There is probably a little bit of risk, and that's from your blood. If you get testosterone given to you, your blood level gets up a little bit, and your blood can get a little sticky, and that's kind of like prothrombotic. That is a little bit of an extra risk. You can just get blood, and it's fine. Clear advantages in muscle mass, libido, erectile dysfunction. It will get rid of menopause. Just like the way women will take HRT. There's lots of ways to do it. Go to a urologist, there's implants, there's gels, there's all kind of stuff. There's a nasal spray coming out. It is very advantageous for diabetes. We're preventing it and getting it better. So you definitely go to a board certified person. If you have cardiac problems, before you do it, you gotta see a cardiologist. Because some people may not be good for it. And again, it's another trade-off, right? It's a trade-off in life. Like, yeah, a little bit of risk, feel like you're 10 years younger. So after 50, even there's no guideline, see a cardiologist. At least get checked out once, maybe do a stress test. And if you're any type of heart failure, you need to see someone like me, and we have cards and stuff. And again, our greatest strength is our greatest weakness. Women are different from us. Men are, most men, when you have kids, a job, and family, always put everything off for those things. And that's what makes us men and providers. It's been that way for thousands of years. But we don't go and get the help that we need soon enough. And a lot of times it's too late. I'm 50, I haven't scheduled my colonoscopy yet. I don't even want to know. Like, I just don't want to know if I have colon cancer. Any questions?
Someone like me, young, testosterone, I don't know what it is.
How old are you?
I'm 33. Do I go get tested?
No.
No?
Nah, you don't need it. Unless you injured one of your testicles and have blood, you don't need it. It's for guys really that is starting to creep low. It actually will help you a lot. It really will.
What was the question?
The question was a young guy needs it.
Or I don't know
There's a young guy. He doesn't know, but no, you really, really don't. It is very safe. It really does help you a lot better. But there's trade-offs. Like women used to take hormonal replacement therapy after menopause. It does increase cancer a lot, but for testosterone, not so much. Okay, and also Viagra. Viagra's fine. If you have problems, they want to hear something. Viagra, no problems with it, no really risk. If you're taking blood pressure meds, just don't take them that day or that night. And also pre-medicate with 500 Aleve or some Motrin. It will give you a headache. Don't mix it with booze. It will because it basically dilates the blood to the penis. You have an erection. Also dilates the veins in your head. I think that was it. Anything else? Yes, sir.
Recommend taking any of the statins if you have family history of cardiovascular diabetes.
Yeah, I take a statin. I think you should. It decreases inflammation. You may not have to take a lot. You take one of the weaker ones. Yeah, you could get some muscle cramps, but again, inflammation is very important. Yes, sir.
As someone that's going to turn 50 in May,
Yeah.
and I go to my primary and say, look, I want to make sure it's...
Only if you need pre-authorization. Just go see a cardiologist. Those guys, Dr. Cotto and I, We did our 3 years internal medicine, then we did 3 years of other fellowship, and then we did other fellowships. It's just like, I don't go to my primary care doctor for a urology problem. Just go. Yeah, if you need approval, that's it. Yeah. Any other questions?
If you do have any additional questions and you don't want to ask them, potentially you want to ask
Yeah,
them
I'll be back
private.
there.
Again, so we're going to ask a doctor's right there. Dr. Schmittner.
Hey guys, I take testosterone. I know what I'm talking about. Without it, I feel awful. And I will take a little bit of Rosine, but I feel great.
Thank you.
So I'm walking my talk. Don't tell anyone.
Thank you, Dr. Schmittner. Give him a round of applause. Right here. Again, he will be over here for the next 10 to 15 minutes. We are going to take a quick 10-minute break, and we're going to have Dr. Kodo, our interventional cardiologist, come up next. All right, so we'll be back here in